Hi, I'm Dr. Quincee Gideon. I'm a clinical psychologist and the owner at Woven Together Trauma Therapy, and I want to tell you a little bit about how Brainspotting therapy works at Woven. As with any therapy at Woven, we really want you to start by getting to know your potential therapist. We do that with 15-minute free consultations where you connect with your therapist, you're able to ask questions, and there's a conversation between you and your potential therapist about what is recommended as far as a course of treatment. In Brainspotting therapy, we have two different options. We have the weekly therapy, which would be a set time, a 45-minute session that you show up to every single week, and you use Brainspotting in order to process your trauma. We also have Brainspotting intensives, and those are 3 or 5 day intensives of longer periods of time where you are with your therapist processing trauma. I think intensives can be really helpful for those who have a really hard time week to week, kind of white-knuckling it until their next therapy session. If this is you, if there is a trauma that really kind of haunts you and you're ready to get that in your rearview mirror, then intensives are a really good option for you. They really allow you to focus on what is going on, the symptoms that you struggle with the most, and really process those with intention. If setting aside intensive amounts of time is not for you, I highly recommend our weekly Brainspotting therapy, which means that you would show up every week, you'd be working on the symptoms that are most problematic to you, you'd be working on the memories that are most traumatic to you, and you would be breaking those down slowly over time with a trained professional that knows how to support that process. As with anything, we do not recommend doing trauma therapy outside of the bounds of an informed trauma therapist. We also deeply believe in resources. So one of the things that we do in any sort of Brainspotting therapy, whether it's weekly or intensive, is that we give you a long list of resources. We give you a few activities, a few grounding activities to do before the session. We also give you a few good ideas of ways that you can prepare yourself for the session. We want this to be really helpful and really soothing for you, and part of that is in the prep work. So we send those over. That's available to any of our patients. We definitely want to support you in any ways that we can. What other questions do you have about Brainspotting? We're here to help. You can email us at any time at hello@gideonpsych.com. You can also reach out in other ways, whether it's through scheduling a 15-minute consultation or filling out the form on our website. We're happy to help and answer any of your questions along the way. We are here to support you. I'm so glad that you're here, and welcome to Woven.